Good afternoon. Thank you for allowing me to join you today as you discuss communications efforts around the U.S. government's HIV/AIDS programs. I regret that I cannot join you in person. I want to thank my friend and colleague Miguel Gomez for inviting me to speak today. I want to take this opportunity to share with you my vision for the future of the U.S. President's Emergency Plan for AIDS Relief. But before I get started, I want to thank you for your hard work and dedication in fighting HIV/AIDS. I've been working in HIV/AIDS for 25 years, but both domestically and internationally. I've seen firsthand the impact of communications efforts like those you are leading, particularly in fostering dialogue about HIV prevention, promoting access to life-saving treatments and care services, and breaking down the barriers of stigma and discrimination. So thank you for taking on the challenges of the epidemic every day. Only a few short years ago, in most of the sub-Saharan African countries where the United States is now engaged, HIV-positive patients were 2 or 3 in a bed, put on the floor in the hallway of all hospitals and clinics. They were waiting for treatments that basically weren't available. Today, the situation is markedly different. Launched in 2003, the U.S. President's Emergency Plan for AIDS Relief, also known as PEPFAR, is the largest commitment by any nation to a single disease. PEPFAR has brought hope to millions of people across the world with its prevention, treatment, and care programs. In 2009 alone, PEPFAR has supported life-saving antiretroviral therapy for more than 2.4 million people, essential care to nearly 11 million people, and counseling and testing for nearly 29 million people. And through PEPFAR's support, efforts to prevent mother-to-child transmission, nearly 100,000 babies of HIV-positive mothers have been born HIV-free in the past year alone, building upon the nearly 240,000 babies born HIV-free over the past 5 years. But unmet needs are still the dominant feature of global HIV effort. We have gotten through approximately 1/3 of the population that is in need of care, and the millions who are participating in high-risk behaviors who need prevention interventions. Globally, there are nearly 33 million people living with HIV, 2.7 million new infections occurring annually, and approximately 2 million deaths. For every 2 people we put on treatment, 5 more have become infected. AIDS is still the leading cause of death for women of reproductive age. If we are to sustain the gains we've had and made against this epidemic in the coming years, PEPFAR must work in closer collaboration with country governments to support and mount a truly global response to the shared global burden of disease. First, we're going to begin transitioning from an emergency response to a sustainable one through greater engagement with and capacity building of governments. PEPFAR had already started this with our Partnership Framework activity. Partnership frameworks provide a 5-year joint strategic framework for cooperation between the U.S. government, the partner government, and other partners to combat HIV/AIDS in the partner country through service delivery, policy reform, and coordinated financial commitments. Secondly, we're going to focus on prevention. We're going to scale up highly effective prevention interventions like male circumcision and prevention to mother-child transmission, targeting of high-risk groups. And with treatment, we will continue a strategic scale-up of services to more than 4 million people. As we carry out these prevention, care, and treatment activities, we will do so with an eye toward how these activities strengthen the broader health system. We will work not only to continue our quality delivery of services and expansion of both care, treatment, and prevention services, but we will also look to create a durable response that can benefit the entire healthcare system and continue the expansion and capability of services for what are often HIV-positive populations. The fight against global AIDS is a central piece of the foreign policy and global health agenda outlined by President Barack Obama and Secretary of State Hillary Rodham Clinton. The administration's Global Health Initiative will continue our country's leadership on global health priorities like HIV, tuberculosis, and malaria, as well as expand our focus on integrating current programs with those that address maternal and child health, family planning, and neglected tropical disease. Investing in global health as well as broader development efforts is a critical component of smart power. Better health leads to improved safety, security, and prosperity for countries. At the State Department and throughout the administration, there's a solid understanding of the importance that health and development programs play in achieving our foreign policy objectives. The United States government is unified in its commitment to the fight against global AIDS. I look forward to an ongoing dialogue with you as we foster greater coordination and collaboration between the United States government's domestic and international AIDS programs. Thank you for your partnership as we work together towards the shared goal of a future free of HIV.